Now, what is thrombocytosis? A platelet count which is more than 450,000 per microliter is thrombocytosis. Now, when a patient comes to you with thrombocytosis, you find a high platelet count on complete blood examination. What could be the possible reasons? The most common reason for thrombocytosis is secondary thrombocytosis. It can be primary thrombocytosis, but secondary thrombocytosis is far more common than primary thrombocytosis. Now, when you've got secondary thrombocytosis, presence of systemic diseases should be looked for. For example, inflammatory conditions like rheumatoid arthritis, inflammatory bowel disease, the other type of connective tissue disorders can increase platelet counts. Similarly, infections, maybe they're viral infections, bacterial infections, or fungal infections, they can all increase platelet count. And then you look for the malignancies, particularly the malignancies in the lung, the GI tract, ovaries, or lymphoma can be a reason for thrombocytosis. And then certain patients may have thrombocytosis because of iron deficiency, and then patients may have high platelet count because of certain drugs like non-steroidal anti-inflammatory drugs and corticosteroids, so they may have high platelet counts. Similarly, you should take the history of trauma, surgery, the splenectomy, or acute or chronic blood loss. They can all increase platelet count. So look for the presence of these conditions. Could they possibly be cause of this thrombocytosis? And then you got primary thrombocytosis, which is a malignant disorder of the bone marrow. And you see other myeloproliferative disorders, they can also present with thrombocytosis. For example, polycythemia vera, sometimes CML as well, and myelofibrosis and myeloid metaplasia, they can all present with thrombocytosis. So when you got thrombocytosis, decide it's a primary thrombocytosis or secondary thrombocytosis. For secondary thrombocytosis, look for the presence of features on history and systemic examination.